Welcome to the Twin Stim 2 Digital TENS and Muscle Stim Device Training Module, where we cover muscle stimulation. We're going to cover cautions, introduction, alternate and synchronous, ramp, on-time, off-time, the purpose of this device, and we're going to do training on alternate and synchronized so you can actually feel it, and you'll be doing it yourself with me. I'll have a device in my hand. I'll be doing treatments on one of my legs, upper legs, thigh. You'll be doing the same thing. You're going to be treating and training on a non-injured part of your body. So let's get started. This will take about 15 to 20 minutes. And certain training is not included in this module 2 that is included in module 1, the TENS. So please take the TENS training module 1 first. And feel free to pause this training module at any time during this training to read the screen, take a break, or anything. I'd like you to read this entire screen, so pause this slide and read this entire screen. But basically, federal law, USA law, restricts this device to sale by or on the order of a physician. This training module is for educational purposes only. Again, please pause this training module and read our website disclaimer before proceeding. And also consult a physician or a clinician therapist who prescribed this device for your specific treatment settings and electrode placements. Now, we're going to cover how to scroll through and use the different settings and how to use the device, but specifically what settings are best for your home protocol, your home treatment protocols, are going to be based on the clinician or therapist that recommended this device. My name is David. I'll be training you in this tutorial and the other tutorials. I've fit between 2,500 and 3,000 people with electrotherapy since 1996. I've worked with professional athletes, professional NFL football players, and Major League Baseball players, arena football players. I've seen just about everything when it comes to electrotherapy and work comp injuries from an electrotherapy provider standpoint. I've never had a major injury, catastrophic injury, endured severe or chronic pain. Nevertheless, over the years, I have developed a passion to help those who have suffered catastrophic injuries or injuries of any sort. This tutorial, again, is for educational purposes only. I'm not a physician, trainer, therapist, or electrical engineer. I'm speaking as someone who has fit over 2,500 people with electrotherapy. Again, you must read the entire manual you received with your device before operating this device. And you can also view the manual online at our website. Quick device overview. If you've already gone through training module 1, you know that it's an excellent device. It's very durable. It's 2 channels. Each lead wire inserted here runs off 9-volt rechargeable batteries. You have a dual charger. You open up the front and you get to the programming features with a little menu that kind of gives you an explanation. This belt clip is pretty sturdy. The battery goes in the back here with the slide going down, putting it in correctly. However, we prefer that you use your device in the fanny pack, safety pack, so that if the wire gets yanked, the device doesn't get pulled off your person and hit the ground and break. The worst case scenario, a lead wire breaks, and we do provide you with 2 sets of lead wires. The Twin Stim 2 is a digital multifunction TENS and muscle stimulation device. It's a 2-in-1 device, and it is pretty much the fastest growing, most prescribed model nationwide. Now you can, again, view or print a manual instructions. We have instructions with pictures that you can scribble on if you want to print one of those off our website. There's also general information that you can print out regarding muscle stimulation from our website. And this is a visual and audio tutorial, which again you can pause to cover the device, supplies, and its purpose, or take a break. Now with your device in hand, we're going to prepare the device for use, and we're going to use it now. So if you don't have your device in hand right now with electrodes and a battery in the device, or ready to go into the device, then you need to pause this training and go get your device. Okay, so I'm going to assume you have the device in your hand. You're going to take the lead wires and you're going to use the connector base and you're going to insert them snugly, snug, in the device. Obviously, you've taken this off the lead wires, and these are the pins, and very gently you're going to put the pins in the pigtails of the electrodes. And you're going to take 2 electrodes from 1 wire, and you're going to put it on either your left thigh or your right thigh on the inside. 1 wire on the inside of your thigh. We're going to do your large muscle group, thigh, non-injured area, for training. The other wire, the other 2 pads are going to go on the outer part of your thigh. I'm using my left leg right now. So, you've got a battery in there. This is where you're going to turn the device on, the amplitude, intensity dials. You're going to turn these on. Each one will feel a snap, and you'll see the screen come on. However, do not turn them up at all. No power going through your device. It's just on. It's like the TV's on, you see a picture, but there's no sound. Okay, don't pull on lead wires to to get electrodes off your body. If you pull on the lead wires, just kind of yank, and people pretty much always try to do this, they get lazy. You can break the pigtail connection, the pin connection here, 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 or here, and then your wire's no good. If you treat your equipment and supplies properly, then 2 sets of lead wires should last you for at least 12 months or longer. Now, as you've learned in training module 1 with the 10s, we're going to go over real quickly. This is the programming center. You have modes, selections or settings within each mode, and moving up or down or scrolling up and down the parameters of any setting. Your device is on, but you have no power to it. You've got 4 pads on your leg. I'm using my left leg. 2 on the inside, 2 on the outside. We're going to do some training. Now, as you know, in the muscle stim, you learned in the 10s training module that you can change pulse width, pulse rate, the timer. You also have 5 modes, 5 pain modes to select from. And within each mode, you can change the pulse rate, the pulse width, and the timer. Now, in a muscle stim, you have less modes, but more, we'll say, features or settings than the 10s. In this case, you also can change the pulse width and the pulse rate depending on what your therapist or clinician thinks is the best. But you also have, and you have a timer, but you also have a ramp on and off. Ramp on and off. So what we're going to do now is we're going to show you the 2 settings in muscle stim that you can practice on, A or S. A or S. S is synchronized. So I want you to have your device in hand, and I want you to push that mode button until you see S on the screen. In other words, you should see EMS for muscle stimulation mode, and then to the right below that, you should see S. So keep pushing the mode button until you see S, because we're going to do synchronized. So now that's the mode you're in. You're synchronized and muscle stim. Under the mode, to the right of the mode, you'll see EMS, and right below it, you'll see S for synchronized. Now, I want you to push this set button. And again, if you learned in training module 1, if you're in a parameter and it's flashing, you can change the parameter. If it's not flashing, you have to push the set button again until you get to that parameter. So keep push the set button until you see ramp. I want ramp to be at 5 seconds. So if you see ramp and that number flashing, go up and down or up or down until you see 5. I want 5 seconds for this training. 5 seconds. In other words, this device is going to ramp up from 0 power to full power over a period of 5 seconds. Now, ramp is 5 seconds. Hit the set button again. Now it should say on. I want the on button to be 15. In other words, it's going to ramp up from 0 to 5 seconds until it's at full power. Then at full power, it's going to stay on an additional 10 seconds. So that that on time of 15 includes 5 seconds of ramping up from 0 to full power and an additional 10 seconds at full power. Now push the set button again until you see off. I want off to be 30 seconds. So it's going to ramp up over 5 seconds, stay on at full power for 10 seconds, which you'll be contracting with it. You'll be flexing your thigh muscle with it without bending your knee or anything to put any stress on the surgically repaired knee or body part that you would ultimately be treating. I want the off time to be 30 seconds. That means it's going to go off for 30 seconds until it starts over again. And we're going to do for the training session the timer. Push the set button until the timer's flashing, and just put for training 20 minutes. Okay, so now I want you to hit set. So now you can see ramp is 5 seconds, total on time is 15 seconds, off time is 30 seconds. You've got the timer set at 20 minutes, and then we're going to set the width and the rate. So push the set button until you see width, and make the width to make it 150. Let's try 150. So now the width is at 150, and you hit the set button, and rate will be, let's put it at 40. So again, if you scroll through this, just pushing the set button, you're going to see ramp 5 seconds, on 15 seconds, off 30 seconds, width 150 pulse width, rate 40 pulses per second, a timer of 20 minutes. Now you're pretty much ready to do a treatment. So wait till it stops flashing and take about 5 seconds. Now slowly turn those dials up in unison. And if it doesn't turn, if the device has been on for a while, you might have to turn both those dials off. Now that you've set it, turn it back on, and then turn it up, and you should start to feel your legs contracting. And make it comfortable. We're just doing training here. And then basically what you're going to feel right now on your thigh is you're going to feel it slowly contract over 5 seconds till a full contraction, and you're going to be flexing your leg without putting any pressure on your knee. Just pretend that if you're working on your left leg, that you had knee surgery on your left leg or your left knee. So it should ramp up. It should start to cycle. Ramp up over 5 seconds. Stay on for a full 10 more seconds. Ramp off and be off for 30 seconds. And then do that for 20 minutes. And you might want to keep your legs straight, so maybe laying it on a couch and keep your legs straight. And just flex with it. So this is muscle stimulation in the synchronized. Now, if you were going to do A or alternate, everything would be the same, except it wouldn't do both channels or both lead wires at the same time, all 4 pads. It would be doing them in an alternating session. So let's turn this device off all the way down to 0, and keep it on because you need to keep it on to program it. Now you've felt that all 4 muscles contracting at the same time. That's synchronous. Now we're gonna do a training on alternating. And why would you do alternating? Well, it depends on what your therapist or clinician or physician wants you to do. But let's say you want to work 2 muscle groups at the same at the same treatment, but not at the same time. So let's say you want to do your bicep and your tricep, or your thigh and then your calf. And it depends. Like if you're doing a large muscle group, you might use both wires, all 4 pads. If you're doing a small muscle group, you just might use 1 wire, 2 pads. If you're trying to do your arm, let's say you want to do your bicep and then your tricep, well, it might contract two pads on the tricep, 2 on the bicep. So you flex your tricep and then you flex your bicep, and then you flex your tricep and then you flex your bicep. So you're alternating back and forth between muscle groups during the same treatment. Or you're doing a large muscle group and you're using all 4 pads, both channels at the same time. But for practice, let's push the set button, and let's push the mode button until we see A on the screen. So I'll push the mode button and I see A on the screen. So I'm going to hit the set button, and we're just going to say ramp is still at 5 seconds, on is 15 seconds, off is 30 seconds, width 150, rate 40, and the timer we'll say is 20 minutes. And hit set. And then turn it up slowly. And you're going to see it alternating between 1 wire and then the other. So you should feel your device. If you have to turn it all the way off to reset it to get going again, mine I had to do that. Okay, so right now I can feel my inner thigh contracting. And now my outer thigh contracting. It's alternating between muscles or muscle groups. So it's pretty simple. Synchronous or synchronized means all 4, both wires, both channels, all 4 pads at the same time. Alternating means you go from one channel to the other, back and forth. Let's review this. Synchronous means both channels occur at the same time. You've got the ramping up till full power. Why do you do a slow ramp up, maybe 5, 6, 7, 8 seconds? Because you don't want to yank the muscle. If the muscle is, if you've just had surgery and you've had your tendons or ligaments or joints or whatever surgically repaired, then you do want to do muscle stimulation treatments because that's what your clinician wants. You want it to go very slowly. You want it to ramp up very slowly. You don't want to have the muscle jerk and yank super fast because it could pull something apart that was just surgically attached. So you can go very slow on that. On time is just how long you're flexing where you want a full contraction. Ramp down, it's automatically. So again, if you have an 8-second ramp up and you want full power to be at 10 seconds and ramp down to 1 second, then you would have the on time be 19 seconds. Off time should usually be 2 times the on time. So if you want a total on time of 15 seconds, then you should have off time of at least 30 seconds. And the timer is what you set it at. And if you set it at 5 minutes, then you're doing muscle exercises for 5 minutes. We'll cover pulse rate and pulse width again. You should have already covered this in training module 1, the tens. Rate is how many individual pulses per second. So 1, 2, 3. Width is how many thousandths of a second each actual pulse exists. Is it a short or is it larger? The wider the width, the more intense or strong the pulse is going to feel. Again, you need to contact your medical practitioner to prescribe this device for specific parameter settings. However, there are some general information on muscle stimulation on our website. The timer mode, again, as you know, it just counts down automatically, and you might have your tens unit on for 10 hours, but you're not going to do muscle training for 10 hours unless you're a professional athlete and you're really in an aggressive program. You're going to want to train the muscles for whatever time the clinician wants you to, but always be conservative and always start slowly, especially if you've been injured for a while and your muscles are out of shape. Now let's talk about muscle stimulation in general. While you're having a treatment done to your leg, a training session, it's contractions back and forth. Basically, it's an accepted and proven way of treating muscular injuries. It works by sending electronic pulses to the muscles needing treatment. This causes the muscles to exercise passively. In other words, you're not bending your leg back and forth on a leg extension machine at the gym, putting a lot of pressure and stress on the knee joint. You're flexing passively with the muscles as they're contracted by the device. It's been around since the early 1800s. And the twin stim is an excellent device, very durable, very, very effective, and it's a dual device, so you can manage not just pain, but also any muscle integrity issues, muscle spasms. Now, the purpose of muscle stimulation is for relaxation of muscle spasms, and there are certain settings for that, and when you go into the, you can look at it specifically on your training manual or talk to your clinician, but basically what you're going to do is just, you want to put the pads on the muscle. What people prescribe is that you put the pads on the muscles, and then you might even put it on the constant pain, the TENS mode, and then it just contracts the muscle, and it just contracts it back and forth until it fatigues it, or tires it out, or kind of gets it back into a normal function. It's also, muscle stimulation devices are also used for the retardation of disc atrophy, increasing local blood circulation to an area, muscle re-education and nerve re-education. The muscle stim device sends comfortable impulses through the skin, and it stimulates the nerves in the treatment areas. When the muscles receive this signal, it contracts as if the brain has sent the signal itself. And the signal strength as the signal strength increases, the muscle flexes as in physical exercise, again without putting strain on any surgically repaired joint or ligament or tendon. When the pulses cease, the muscle relaxes and the cycle starts over again after the rest cycle. Think of it like a massage. If you can also use the muscle stimulation to increase local blood circulation, like a massage. If you're getting a slow, hard, deep massage, you don't even really have to be flexing with it. It can just be like massaging the area, increasing blood flow and circulation, or you can kind of do a fast karate chopping massage like we talked about in the TENS training module. You have a lot of flexibility with your electrotherapy device. You just have to make sure that your clinician or your physician is specific with you on what they want you to do and what's the purpose of this device. But you also want to be able to know how to program the device and adjust all the settings when you're home by yourself. If you are using a muscle stimulation device correctly and you're maintaining muscle integrity, then historically that's helped people even with pain. Because if you have strong muscles that support your skeletal system correctly, especially your back, then you have better posture. And if you have better posture, that puts less stress on the spine or the body parts, and that helps reduce pain in and of itself. Make sure you review the contraindications and the precautions and the warnings from time to time to make sure that anything in your health hasn't changed that would maybe have you discontinue using this device. If you have any questions, please call us or email us. You can call us 24 hours a day, 7 days a week. We don't always answer the phone in the evenings or on the weekends, but we do have our phones transferred to our mobile phone, so we'll get it pretty quick. Congratulations. We hope you benefit from your device and wish you the best. Give yourself a hand.